All right, we would like to call to order the Audiology Practice Committee. So we'll start off with a roll call. And first one on the roll will be myself, Dr. Amy White, dispensing audiologist, the committee chair. I'm currently located at the board office in Sacramento at 1601 Response Road. And if I can ask for Karen Chang.
Hello, this is Karen Chang. I'm currently at the Law Office of Scott Wormuth at 17700 Castleton Street, Suite 168, City of Industry, California 91748. And there is nobody in the room with me except for myself.
Okay, thank you. And Dr. Chambers.
Hi, this is Tamara Chambers, otolaryngologist. I'm here at the Galeras Family Education Center, 427 West Carroll Avenue, Room 2, Glendora, California, 91741. I'm here with Gilda Dominguez.
Thank you. And Dr. Sanders.
I'm Dr. Charlie Sanders, and I am at the board office on Response Road, and there are no members of the public present.
And board staff.
We have myself, Sharice Burns, Executive Officer of the board, Maria Lorenzo, Legislative and Regulatory Analyst, and apologies earlier, I forgot Tim Yang, who's assisting us with the WebEx. He's one of our enforcement analysts, and then I'll let council introduce themselves.
Yuping Lin, Board Counsel.
Grace Arupo Rodriguez, Acting Regulatory Counsel.
All right, and we still have Mr. Borges here attending the meeting, although not participating on the practice committee. So, all right, so we have time now to go to public comment for items that are not on the agenda. Please open that up.
We are open for public comment for items not on the agenda. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand. And for our mobile device users, you may need to hit the ellipses button, that's the ... in order to find your hand. People will be given 3 minutes to speak, and I'll give you a 30-second warning before your time expires. Our first request is coming from Jody Winselberg. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Thank you very much for unmuting me. Hello, everybody. Thank you for having public comment. I just want to make a public comment about, I listened with interest to the hearing aid dispensers committee, and I'm very appreciative of Amy and Charlie, your input into that. Thank you very much. And also for the otolaryngologist, very much appreciated. I would just like to ask, and I'm wondering if at some point we can come back to readdress the hearing aid dispensers examining practical committee for audiologists and the elimination of dual licensure, which went into effect on January 1st, 2010. I'd like to suggest perhaps, since we did agree with the legislature to have a test for the audiologists, that we consider using the written test that's already in place, and perhaps put in there language and questions that revolve around contract execution and the laws surrounding the dispensing of hearing aids, as to not to have to burden the board with creating a brand new test when we already have one in place. So that's really all I came here to say, and I'd appreciate the board to reconsider, and this committee to reconsider what we've already known to be taking place, but it's kind of taking a long time. So that's my comment, and I thank you for the mic.
Thank you. And that was our only request for public comment on this agenda item.
All right, thank you. All right, the committee will move on to agenda item number 3 on today's agenda, which is the overview and discussion of consumer protection and licensing issues related to potential creation of an audiology assistant license type. And I would ask Ms. Burns to present this agenda item for us today.
Thank you, Dr. White. So the board received a letter, attachment A, from the California Academy of Audiology to open a discussion with the board on the possibility of creating a new license type for audiology assistants. So at its October 2022 meeting, the board discussed and reviewed the Sunrise process and delegated to this committee the task to provide the board with a recommendation as to whether to pursue the Sunrise process to create the audiology assistant. and whether or not, and determine whether it's an appropriate action for the board to take. Business and Professions Code Section 2530.1 states that the practice of speech language pathology and audiology and hearing aid dispensing in California affects the public health, safety, and welfare, and there is a necessity for those professions to be subject to regulation and control. So, however, it says in Business and Professions Code Section 2531.02 that protection of the public shall be the highest priority for the board in exercising its licensing, regulatory, and disciplinary functions. So whenever the protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. Not saying that it's in conflict here, but when recommending that the board take an action such as sponsoring legislation or creation of a new license type through the sunrise process, we should always be looking at, is the protection of the public the lead issue? And that's why the board should take that leadership issue over it. So the sunrise process is a very specific process. There's not too many that have gone through this process. You can find that on the Assembly Business and Professions Committee publications reports page. You scroll down after all the normal reports and you'll see the few sunrise reports. So the legislature's gotten better over the years to say, hold up, let's, if you boards are just going to create a bunch of things, we want you to go through this process, right? We want you to really think about, is it necessary for consumer protection? Have you looked at all the aspects? So there's a sunrise process. And if you look at some of the attachments here, the second attachment is the sunrise process, review of the process, its background, why they've implemented it. And you'll see on page 2 of that is the sunrise criteria and the evaluative questionnaire, right? So you really need to have these criteria in mind when the board's going to sunrise a license type. It's that the unregulated practice of the occupation in question will harm or endanger the public health, safety, or welfare. Existing protections available to the consumer are insufficient. There are no alternatives to regulation that will adequately protect the public. Regulation will alleviate existing problems, and practitioners operate independently, making decisions of consequence. The functions and tasks of the occupation are clearly defined. The occupation is clearly distinguishable from other occupations that are already regulated. And the occupation requires knowledge, skills, and abilities that are both teachable and testable. And then lastly, the economic impact of the regulation is justified. So they kind of have a high bar for boards just creating a bunch of license types, right? So you really need to show them that you can answer all these questions and that there is a protection of the public and consumer welfare as essentially the biggest impetus for going towards this, right? So that when the board is going to be the main actor and sponsor something. So if the committee is interested in pursuing the creation of the audiology assistant license type as the board pursuing it rather than an association, then we would need to go ahead and look at all these questions, start filling out the questionnaire and meeting all of those criteria to determine that there's consumer protection need to create the audiology assistant license type. And then we would work on completing the questionnaire for submission. Now, I tell you this, and I tell you that there's only a few of those reports on that website. There's a link in there. You can go look at it. But that's where, for board staff, it seems like for the board, that high criteria of consumer protection and the public health and welfare, the creation of the assistant type is necessary, but not for those reasons per se. While it does help protect consumers, so does enforcement of what an aid should be doing, enforcement of what's in the audiology scope versus the aid. However, I would say, so when we take a look at these things, the example that was asked about was the speech language pathology assistant, or the SLPA. So the SLPA was created actually by a bill sponsored by the California, well, it's called this at the time, its name has changed, but the California Speech Language Hearing Association and the California School Employees Association. So CSEA, a union, and what's now CASHA. Okay, so the association spearheaded this effort. And so that's one of the other ways that this can be done if the committee decides, yeah, we don't see where we would meet all of those criteria. We may not be able to prove all of that as a necessity for there. There is the other avenue of professional association spearheading the issue and championing their own bill. So going to the Assembly or Senate, finding a member, asking them to be the author of a bill that they sponsor, and work, of course, with the board to ask technical assistance. And we're always happy to provide technical assistance to our stakeholders and legislators alike. And that's where sometimes the nitty gritty of making sure legislation wouldn't have undue consequences or overly restrictive. So one way would be this, where similar to the SLIPA, or what is also a more recent example is the psychological testing technician registration. Both of those new registration and license categories were created by the association with a separate bill. So if you look at attachment E, you'll see some of these examples. So attachment E is actually the bill for the psychological testing technician, where the Psychological Association for California worked with an author to get this legislation passed. And this created a new license type for the Board of Psychology. And this is for the backstory being that psychologists, neuropsychologists have a very long wait time to see clients, and there's many people suffering from traumatic brain injury that need to be evaluated and assessed and get treatment. And for that category, a psychological testing technician could do these standardized battery of tests that are, they just fill in the answers, they do the standard battery, and then the results are given to the psychologist, the neuropsychologist, for review, analysis, and determination. And this created a license type. It gave it educational requirements, it's got renewal requirements. And then if you go to the next attachment, which is attachment F, you'll see the Senate, and then after the Assembly, these are their analyses. So these pieces of legislation were brought by the association, and of course, they're going to tackle a lot of the same issues, right? They're going to have to prove to the committees, why does this license type need to be created? What is it for? So in this instance, if the creation of an audiology assistant increases access to healthcare and also advances the profession, and your association, the California Academy of Audiology, is spearheading the bill, you could go and find an author. Let's just call it Archuleta, because that's who they found. But that person, that author, would put in that text for you, and then the association would be doing the advocacy for it. But the board can always be providing the kind of technical assistance. Part of that is having the conversation about what are the consumer protection issues if we create this new license type, or not if we do, but if the license type was created, right? So some of these I've detailed in the memo. So some of the consumer protection issues, because again, we're staff, we are not audiologists and speech language pathologists here. So things that we can consider and have discussions about that can inform and provide information to the association about concerns. So what are audiological procedures and tasks that should be outside of the scope of an audiology assistant because they're too advanced or they carry too much potential for patient harm? For example, the SLIPAs have a certain set of duties that are outside of the scope of the speech language pathology assistant. And similarly, any new creation of an audiology assistant would potentially have items that are outside of the scope. Are there certain procedures and tasks that should be prohibited altogether? Prohibited unless an audiologist is physically present in the room, prohibited unless there's direct supervision, meaning on-site, so that they are in the building, or prohibited when there is indirect supervision. So are there certain procedures that should be prohibited altogether? Maybe not due to the complexity, but because they're within the scope of another license. So right now, a hearing aid dispenser to dispense hearing aids in the state of California, you have to pass certain exams, right? So you couldn't just let an audiology assistant sell hearing aids. They'd have to go and get licensed with the appropriate exams. So those are kind of the initial questions that staff had about the audiology assistant. And I don't know if you want to me to read through them all or let you start talking on them. But I know we're at the discussion questions part. But I wanted to give that overview because of, oftentimes it's hard to kind of keep that like what's in our jurisdiction. But when the board's going to bring something, we'd have to do the sunrise process. We would have to prove there's a consumer protection issue and we're addressing it here and here's why. As where if the association wants to lead the way, we can provide technical assistance as they create it, but they would be the ones spearheading it.
So are you saying that if the association led the charge here, and not the board, that the bar that is set, on the legislative side of getting a sponsor for the bill, et cetera, but that bar isn't necessarily as high in terms of justification as it is if we were to sunrise it as the board?
Absolutely, because you'll notice in the psychological testing text, there was no sunrise report on that website, right? They didn't have to write a full report detailing all this stuff. They provided the information of why it was needed to the author to justify it to that author. And then the author had to provide all that information to the committees, which then you see they put in the analyses, but you obviously also see they didn't write a whole book, which that sunrise process looks like you're writing a little book, right? So you still have to provide the justification and information, but it's just not as expensive, right? And I mean, I get that, right? As the government, as we grow, we need to justify that we're growing for a very good reason and that there's not some other private sector mechanism that can take care of it, right? So that's kind of the impetus there. If we as the board are going to champion this thing and create more regulations than another regulated type of license, we have to meet this high bar. If you outside as the other stakeholders say, no, we really need this as a profession, let me tell you why. Well, that runs as a separate bill. You do have to get through the same two committees, but you'll notice they didn't make them do a sunrise report either.
Mm-hmm.
So it is a little bit different of a bar. And so I think they would have less difficulty proving that, yes, this provides increased access to hearing healthcare. Little higher on the bar of proving that it's a consumer harm we're preventing or that we're impacting health and welfare of the public if we don't create this license type.
And I think the use of the psychological testing is interesting because, as an example, because in terms of like trying to make the justification of protecting the health and welfare, and you say, well, it's opening up access. We don't have enough audiologists in the state. We don't have enough audiologists to do the work that needs to be done. And so it is important, obviously, that consumers and patients have access to care. And that is, that would have to be the tactic that's taken, but the psychological testing one had the same tactic, right? But they did not go through the sunrise process because as I'm reading the sunrise criteria and evaluative questionnaire, as much as all what I just said is true and accurate, and one could argue that access does in effect endanger public health in a way, that's about the extent of the argument. As far as I can see it, I don't know, Dr. Sanders or Dr. Chambers, if you read that, or Karen, if you read that sunrise criteria questionnaire any differently, and can think of an additional argument, or that this does require extensive justification as far as I can read it. I don't know.
I agree. The only question I would have is, if the association does provide this and does do that, then at what point does the board come in to provide additional clarification on regulations?
So the board, I'll give you all parts of it. So the board can provide technical assistance while they are authoring or sponsoring the bill. They can ask us questions. We can provide input. We can say, hey, I don't think that means what you think it means. Or, hey, if you do this, that's going to work out this way. Once they pass the legislation, the board can then create regulations to clarify anything if necessary. That would be our role at that point. And so we take on the role of regulations afterwards. But if you notice, the way the SLPAs were written was very broad and open, which meant the board had to immediately take on the mantle of writing it all, right? The SLPA statutes are very broad. There's only a little bit in there. There's only a little meat on that bone. And then we had to clarify everything, right? As where if you look at the psychological testing tech language, they were kind of specific. What are you going to provide to the board? They helped make this this legislation a little bit more self-implementing about saying, what does the application have to include? What are the education requirements? What counts as the equivalent, right? So they made all of this more clear and more meaty than what our SLIPA statute is versus, we have tons of SLIPA regulations, right? But we don't, but there's a very small section in the statute for SLIPA. Yeah, I think it's like 1, 2, maybe.
Yeah, 2 pages.
Yeah, it's very small in the statute. So essentially they said, you know, here's 2 bones, put some meat on it, board, and the board had to go and do that, right? And we did that through regulations. This psychological testing tech bill, as an example, is something that's easier for the board to implement because it's more detailed, right? So it's not, here's 1 bone, go put all the meat on it. It's like, here's the whole structure with the meat on it. Now, if you need to clarify anything further, or again, like define levels of supervision, right? There's also some that might even say, until the board is able to clarify levels of supervision, such and such regulations can apply, right? Or there's different ways that the statute can be created, and lobbyists are really good at that. They always know who to reach out to. And so that's one way that this can work, is that, yes, there's a need. Yes, the association spearheads it, but instead of like the SLIPAs, yes, you run your own bill, but maybe you do a little more like psychological testing text where there's a little bit of meat on the bone and the board doesn't have to define everything.
So before we as a committee get into kind of, if we want to get into the weeds on some of these proposed questions, discussion questions that are in the agenda here, I would ask Karen and Dr. Chambers, do you also agree that it would seem that taking up the mantle for the board to actually create this license type through the Sunrise process doesn't appear to be the track that needs to happen, that this really should go back to the association, or do you feel differently?
I totally agree that it should go back to the association.
Right.
I agree as well. I think especially since there's some nuances, they do have these aides. So where the aide will stop and where the assistant will come in, I think you need some very specific language about how that's going to be managed, regulated, and how their roles are going to be separate to improve the access. And it came from the academy as well. So I think that they should take it forward.
Okay, and I recognize, I'm sure we have a number of public members here ready to talk about it for when we get to public comment. So acknowledging that we may have more opinions coming up about that at a little later. So when I was looking at all of these questions that the board staff put into the agenda here on discussion opportunities related to this license type, what I found most helpful was going and looking at the updated structure, that the proposed language that we have for SLIPAs. I don't know if we can pull that up and share with the public. Sharice, or let's see.
Yeah, if you could go to the board's website, just so that everyone can follow along. If you go to speech and hearing, .ca.gov, and then you go to licensee, and you click on that, and then you click on laws and regulations, and then scroll on down. Keep going, keep going, keep going. You'll go down to regulatory changes. So proposed regulations and regulatory updates, and then go to the third link down that says regulatory changes and finalized regulations. You click on that, you will see the speech language pathology assistant supervision requirements effective July 1, 2024. You click on that, and then if you scroll down, you will see the very bottom link is the order of adoption filed with Secretary of State 3/19/24. And if you click on that, it'll bring up the regulation.
Yeah. So
I think you can share your screen because you're the moderator. bottom share. There you go. Share. And this is from our website, everyone.
So we can move the boxes. So as I was considering all of this, and again, happy to listen to the rest of the committee's thoughts on it. I think one of the things to look at is as the estate association or whomever might take up this issue starts to consider what the board might be looking for, or kind of the boundaries, or how to demarcate the boundaries of this license type. It's more similar to the SLIPA, I think, than a hearing aid dispenser or hearing aid dispenser trainee in terms of, you know, an academic requirement of some sort, and then this supervision requirement. What is direct? What is immediate? What needs to be in the room? What is out of the room? It defines asynchronous and synchronous supervision, which is tied also on the board site. There's a item related to telehealth and what constitutes telehealth and telehealth supervision. And so as I'm thinking through all of it and synthesizing it, I think it would be smart to think forward and to think about, you know, it's a heavy lift no matter who's doing this work to create a new license category and a license type. So if the heavy lift is going to be happening, then looking forward, telehealth is here. How does that relate to the supervision of any of these assistants? What they're allowed to do or not allowed to do, you know, if they're supervised via tele versus in person, or doesn't require supervision, do you need to be in the same building or not? And I think a lot of the new SLIPA language is pretty, I would think, in line a lot with how this audiology assistant one might follow. So I would just, I found that was really helpful to look at in terms of, you know, the education and experience requirements to ensure minimum competency and perform core functions. You know, would it be reasonable to set it up like the SLIPA, where it's an associate's degree or a bachelor's degree or both? You know, how many clock hours? You know, all of those types of questions. I think it was really helpful for the board staff to put together all these questions as guidance. I don't know if we want to go through all of the definitions and kind of give our initial reactions, if we have boundaries that we think the board would, you know, be absolutely opposed to, that we want to discuss at this time, or I don't know, other thoughts from committee members on this?
I think our first thing is how do we respond to their request? And is the board going to make a formal response to the association and say, no, this is going to be your responsibility, but then give them a nice list of all the things that we are willing to do to assist them in terms of support? What information can the board provide, addressing this part where we can direct them toward the SLIPA law so that they can use that language to help themselves get things moving, so they're not recreating something that's already been done before as well.
Well, and I would say at this point, the biggest ask was that they asked that the topic be added to the future agenda, right? So that's where we're having this conversation, so that they can have the discussion, be heard, have the input from the board of what do we think is in our jurisdiction, whether it's a sunrise attempt or not, and then what we're here to help after that. So I think that was my big takeaway is let's start having that discussion and providing the consumer protection input that would be needed if they're going to take on that, sponsoring that legislation.
Because that's really the first answer, is to tell them that it is their responsibility to continue this process, not the board's.
And I think that's why the first part of what we'd like you to do is kind of determine that, right?
Mhm.
Is it our jurisdiction? Are we going to do a sunrise, or would we not be recommending that to the board? And if the committee doesn't recommend that to the board, then the answer is yes, the association, that's going to be something you tackle. And then, yes, we're here to provide technical assistance and our input on what we think consumer protection issues are around the issue. So.
Okay, so it sounds like the committee, you know, everyone weighed in and had consensus that that this was not going to be reasonable for the board to take on as a sunrise issue. Is there a vote that's required on that? No. Okay.
Yeah, I don't think we will, that would need a motion for that.
It would be recommended to the full board to consider.
Yeah, well, and they're not going to recommend that they consider it, so they're determining not to take that course of action.
So I think that would be the vote that this committee would make, like the committee.
Oh,
has
to
heard
actually
it.
make a formal motion that we're
Motion that the committee's recommendation is to respond to this, because this is just a subset of the larger board. So it's for the board then to say, I agree with that recommendation.
So that would occur at the board meeting tomorrow.
Yes.
Well, it's not on the agenda for the board.
Oh,
So you
so it's
can't
not
discuss
on
it
the
at the
agenda.
board. Yeah, you can report out what the committee determined during the
Yes.
Board chair's report, but you couldn't take action on it.
Because I didn't fully read the letter. The letter actually has a specific request for the board to consider this
Yeah.
as a sunrise
Um,
issue. Or is
no,
it
it
more
says
about
at this time,
informational?
At this time, the California Academy of Audiology would like to request that this topic be added to a near future board meeting agenda for further discussion of the
Oh,
issue.
Okay.
In the meantime, we welcome any questions or concerns the board may have ahead of the board meeting.
Okay, so I think from that perspective, you could take a vote this letter was discussed and our recommendation is X, Y, Z, but it would be for a future agenda item.
Put it on the agenda for next time.
And that way it's a committee recommendation as a whole, but we don't recommend going the sunrise route.
So we should vote on that.
I think it just makes it more
Okay.
official in the sense that the committee as a whole has voted on it and the committee as a whole,
Okay. So for opening for public comment related to that specific piece, should we do that prior to the vote? Or after the vote? Prior to the vote.
So
Okay.
you'll need a motion in a second.
Okay. So we need to make a motion first
Yes.
regarding taking a vote on.
And I didn't make you any motion language.
Yep.
I'm sorry.
Okay. So would someone like to present a motion regarding the committee's recommendation that this not be taken up as a sunrise action?
I move to not bring this up as a sunrise action.
Maybe just reference the letter and the date.
In reference to the California Academies of Audiology's letter of January 9th, 2025.
I'll second.
Chambers, thank you. All right, so moderator, would you please open up for public comment just related to this specific item?
We are open for public comment on the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. First, we're going to call on Marcia Raggio. Hold on just a moment, please. We're sending you a request to unmute your microphone. Marcia, are you with us?
Yeah, it's Marcia, and yes, I am with
Marcia,
you. Mm-hmm.
my apologies. And say the last name for us too, please.
Raggio.
Perfect. Go ahead, please.
So I'm speaking as the Northern California Legislative Liaison for the California Academy of Audiology, who sent that letter to you. And I first of all would like to say thank you to the executive officer, the board, and the board staff for compiling the documentation that you did. That is really helpful to us going forward, because you're making an obvious and compelling argument to not to take this on the sunrise route. I do have some questions and some other comments, though. This issue has been discussed for the last 20 years by the board because of problems identifying what an audiology aid could do and what they couldn't do, and just difficulty with that. But one of the impetus for those discussions was the board comments that we got, not only that access was a problem, but that people were allowing audiology aids to do activities that they were untrained to do without supervision. That was a huge complaint that we got on the board. So there's more than one consumer protection issue here. Now, we're not going to be able to go out and look over everybody's shoulder all the time to see if they're not following the honor rule, but that's an issue. So when Sharice Burns said something about technical support, there's going to be a big fiscal aspect to this that we're going to have to rely on the board to provide us with. Could someone speak to that at some point about how they would help craft that piece to any legislation we come up with? If my second question is the SLPs or the SLIPA license, did they attempt to do Sunrise and thought better of it? Did the board say no to them? And that's why Cash had picked it up. Let's see. Updates, no concern. Were there any consumer complaints in terms of the SLIPA license issue that you could tell us about? Anyway, those are my comments and questions. Thank you.
Thank you. Next, we're going to hear from Jody Winselberg. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Thank you very much. As Dr. Raggio just stated, I'd also like to thank the board, specifically Sharice Burns and the staff, for putting that all together as the erstwhile legislative liaison for the California Academy of Audiology. Although I'm not in that position now, I understand how difficult it is and what you have to prove legislatively to get something like this put through. And we were very successful in CAA in working through legislation like this in the past, and the board was tremendously helpful to the association in helping us frame and look at the different points we had to when discussing with the legislators what we wanted to do in the interest of public protection. I just want to bring up a comment that I have and a question. I think that some of the reason the audiologists continue to bring this up to the board is specifically because of the reason Dr. Raggio brought up. We've been talking about this for over 20 years. And unless I missed it, I still don't think there's a defined set of criteria that the board has put forward for audiology aids, memorialized in such a way that scope of practice could be understood. I know that many of my colleagues, and right now I serve as the interim program director of San Jose State's AUD program, as well as the director of clinical education. So my job is training the audiologists of the future. And specifically, access is a problem. And when we look at something like a SLIPA, which I would love to be able to model it around that, but taking it a step further, when we look at the hearing aid trainees that we just talked about in the last committee, hearing aid trainees, as far as I know, they only require a high school diploma, and then they can be trained by a licensed hearing aid dispenser who can train them how to do otoscopy, who can train them how to put headphones on a person, maybe even perform pure tone testing. And so I guess the audiologists really want to understand why is it okay for a hearing aid dispenser to have a trainee that they train to do certain tasks when many of my colleagues have been denied registration of their aid because they say something like, we would like our aid to perform otoscopy to make sure the ear
30
canal
seconds.
is not occluded, so that we can make sure the patient is ready for the diagnostic test. I would wonder if that was something that the board could consider in looking at just defining things for an assistant so that audiologists can be more efficient, see more patients, and always make sure that the consumers are protected in our practices. Thank you.
Thank you. And those were all of our requests for public comment via WebEx. Madam Chair, is the
Apologies, moderator. Could you repeat that?
those are all of our comments via WebEx. If you'd like to continue with the motion.
Yes, we will continue with that motion. Although if Is there any further discussion related to the comments prior to voting on this motion?
I think we can take some of those up. So
So we can discuss the comments that were raised first.
I would think so, and discuss that before taking your vote so that you have the full course of all of the comments and answers. I'm gonna hopefully didn't botch these questions. So the help with the fiscal. The association is always able to ask for the board to provide technical assistance on how costs are calculated. And then also input in there. You can also ask technical assistance of other boards. So, you know, how much did it cost for the Board of Psychology to implement psychological testing tax? You can probably also ask that of their association, and then we can have a ballpark of what it cost them. What did they estimate and how did they estimate it? A lot of what the state will quantify is how many people, additional people would be needed to license an additional population of blank. Because that's this many applications per year. And on the other side, potentially how many enforcement complaints, although that's really hard to measure. So honestly, that's usually a future thing. The other part was, did CASHA lead the effort originally, or did the board try to do the sunrise process? I don't have any evidence in our documentation of the board trying to do a sunrise process. Sunrise processes are considerably newer. I would even say that when I was interning in the legislature many months ago, actually asking for things to sunset and sunrise was more of a new concept to have more effective governance. And so the SLIPAs were created pre those discussions at that time. So I wouldn't be surprised if there was not a formal sunrise application or process back in late 1990s, because that was still somewhat of a new concept. Even though boards have had sunsets for a really long time, the idea that you should also have to sunrise something just to create it, that came along a little later. I am not aware of any complaints about the creation of the SLIPA license category. I'm very aware of many complaints proceeding about SLIPAs and behaviors nowadays, but I do not have any that are about the original creation. We can look back, but it might be very limited in what we could find due to what's in our records. Retention records for complaints that are closed, no jurisdiction or information on file, things that don't result in discipline often after a certain period of time are discarded. So we would probably not have very much information on any of those complaints if we could find them.
And in that vein, the other comment that was raised by Dr. Raggio about, or it could have been Dr. Winkelberg, I'm sorry, I don't remember which, about aides, you know, the current audiology aides, and they're operating outside of, you know, what they're supposed to do. And so it's kind of Wild Westy, and what these people may or may not be doing. Was there a similar concern I don't know, it was a long time ago. I wonder if there was a similar concern before the SLIPA was created, you know, that the aides, right? Because there were speech pathology aides first, or is that different? There weren't aides first.
There were already speech pathology aides at that time, and the legislature also demanded that there be a on-ramp for those aides they've had many years of experience. How can they transition to be a SLIPA if they think they're maybe not their education, but their many years of experience merits them qualifying? So there was a grandfathering period where you could take your aide experience and translate that into being a SLIPA. That ended after, I think, 2003, 4, yeah. So there was a specified period, so that from that beginning, 1999 to 2004, where you could transition from being, I've been an aide for 10 years, I now want to be a SLIPA. I don't have the field work, I haven't gotten a degree, but I've been doing this for however long, and they had that way to transition. I would not be surprised, because I've heard it before. What are you going to do to help those aides that have been long time experienced working in this area to help them transition to this new category? And then there'll be a cutoff. At which point after that, everyone has to meet the education and experience requirements or fieldwork.
And that would be something included in the initial.
Oftentimes that's what the business and professions committees are going to talk to you about. A consultant's going to say, well, what about the existing aides? What about these folks that have been doing it? You might already have audiology aides with CSD degrees but they don't have anywhere to go after that, right? They didn't get into an audiology doctoral program, so what do? They become an aide. Okay, well, yes, they have it, but they don't have field work. Would, one of the ways you can apply with field work that's done under the university, or if you're coming from out of state, because remember, we're now long set up in the slip, but if you come from out of state, you can use some of your work experience towards that. And then you say, who's this? Does the supervisor sign off on it? They say that you meet the requirements, your satisfactory experience, so on and so forth. It's a work experience requirement. So those are some of the alternatives that are also there. I know this is getting very into the weeds, but it's the kind of stuff that people have to think about, right? And so you can peruse the website, look at this, the forms and publications page still has the older PDF versions of the documents for the application. And you can look at the SLPA one, and it has a work experience option there. And that's for now, it's for out-of-state folks. Because all of your field work, if you're doing it here in the state of California, needs to be under the university or the community college that you're doing your SLPA program with. So that's how that operates now. But that's where the audiology aids, there has been, I'm trying to look at, it was last fall where we're finalizing the audiology aids was the other question.
Right.
So talking about what's outside of the scope. So those will be coming along to the board at some point as well. Right now, they're just not up for discussion at the moment. And then the other question, or do you want me to stay on the aids for a minute? Okay. The other question was about trainees, and I would put a caution here. I always try to talk about trainees. I'm not thinking about education and experience at the moment, but trainees, the equivalent of a hearing aid dispensing trainee on the audiology side is a required professional experience or an audiology extern. So different category than an audiology aid altogether, right? This is not a category they're meant to go into and be in long term. That's why there's a time limit. There is an 18 months that they can be a trainee, accrue those experiences, and get that full licensure as a hearing aid dispenser or move on, right? Well, technically come back 3 years later, but you know what I mean, or take another path. Same thing with the required professional experience, right? Or audiology externs out in the field, right? They need to accrue that 1 year of experience. If they need to, they could make it 2 years part-time, and nobody does that. Well, almost nobody does that. But they get that externship, they get that doctoral degree. Just don't think about the education. They are getting the experience to obtain the necessary experience and skills in order to get full licensure in that category. So for a hearing aid side, the hearing aid trainee is the equivalent of the RPE on the other side. And so talking about what a trainee can do as they're getting the experience needed for full licensure as a hearing aid dispenser is not really relevant to an audiology aid who's going to be in that aid category for any long period of time. You could be there for 30 years. So it's not the same. The audiology aid is not there to gain experience for full licensure in order to pass the necessary examination. So it's a difference, a very big difference. So I would just always try to think of it in those contexts and references. When we make an audiology assistant, when it's made, it would also be a longstanding category, just like the SLPA license, right? People are licensed as a SLPA their entire career. They're going to retire as SLPA, many of them. Some will go on and go get their master's and become a speech language pathologist, but many will work their entire career as a SLPA and they will retire. The SLPA is not a category of licensure that is intended to accrue the experience and education necessary to be a speech language pathologist. So again, when we create these assistant or aid categories that are meant to be ongoing licenses, we have to think about them a little different than a trainee or an RPE who's just getting the experience for that higher level license.
I think that's a really great point. And I think, one, we do have the updated supervision requirements for hearing aid dispensing trainees, which I think, that comes from a place of a lot of frustration for the perceived lack of supervision that's required for those trainees. And the board has discussed that at length and change those supervision requirements, or at least has proposed changing them. I don't think it's through yet, right? So, so I think that's really good advice, Sharice. So maybe back to Dr. Raggio's question, so I will speak for myself, and maybe not everyone on the practice committee. However, I feel that this is very important. And I think this is one reason Dr. Raggio and I have definitely talked about this so many times, and as Dr. Winzelberg has as well. It's important for an opportunity for those people who haven't graduated from a doctoral program to be able to be part of the field. It's important for audiology to figure out a way to be more efficient and function in a manner which will allow audiologists to continue to practice, and looking at doing that in a more similar way to something like an optometrist or a dentist, where you have those trained assistants that can do a number of tasks that allow the audiologist to focus on the things that require their expertise. And I think it's vital for the profession to continue to have something like this. So I want to make sure that what is coming forth from the state association, how many opportunities do they have to bring their proposals to the board or to the practice committee for input, so that when the bill is actually out there, the likelihood of the board supporting it and not opposing it, or opposing it as amended, or approving, all of those options that the board has, that we can kind of help the association get through all of those questions in advance. Does that make sense?
And is that what Marcia meant by fiscal?
Yes.
Is that what she meant? How much support are we going to provide that's funded by how much work are you guys going to do as board staff to assist them in all of this research and all of this language to put together, because the association just doesn't have the resources to do a lot of that stuff.
I'm hoping that we are providing a good deal of technical assistance in our conversation and in the examples of the materials, so that there's a stepping board here. There's also the link to contact the Psychological Association of California and find out how they did it. What did they do? Have that quick conversation with them. The board, we will provide technical assistance when requested throughout the legislative process, ahead of the legislative process. The committee can continue to discuss all of these questions and more questions as they are requested to do so. So people can, CAA can ask again, send a letter. We can also continue our discussion about what we think. This is what we as the staff have come up with questions. The committee may also come up with their own questions, and eventually the fiscal will become a part of it. But some of that is also already baked in here, right? So we're talking about under potential licensure issues, right? How big do we estimate the potential licensing population will be? Essentially, we probably aren't going to survey our licensees, but if the association is surveying their membership, and the membership generally believes there's one or two assistants that would be needed per office, or it's just one, then the board knows how many. We can always take an estimate really quickly of how many applications we process per year, how many staff are necessary, and that means money, personnel years, does it cost to review and approve however many applications. Are we talking 500? Are we talking 1,000? Do we think everybody's going to want 3 like the slippas, or is audiology different? And maybe every office might only have 1. Maybe these are all differences that we don't know. But that if told an estimate, we can also calculate personnel years, because I know how many applications we process right now. I know how many staff I have. I know how much staff time it takes, and that equals money when it comes to position types. These are all things we can provide as technical assistance. Normally, I would generally say, unless somebody surprises you with something and writes it without any request for technical assistance along the way, you don't generally come out with a straight oppose unless you're like, whoa, that was out of left field, right? But the fact that we're already having the discussions, we already are bringing up our consumer protection questions, our licensing questions, I think those will get baked into the process.
When as these definitions become more clear, let's begin with the definition of what can an aid do, what can these assistants do, what is the difference then between what a dispenser can do? And so having some input from their association as well, so the Academy of Audiology should be talking to them as well to put all these things
It
together.
would behoove the association to talk to the other associations and start getting input.
Is what are these definitions and where are the lines drawn between each profession?
And I would tell you that we received a written comment. We'll read it after you guys take your motion and everything. Because that person isn't available here, I can read it now.
You can read it now, if it's related to this topic.
It is, but I just read it. Because that way, I mean, what you're hearing is from, I'm glad it reminded me that. Okay, sorry. Dr. Deborah Clark, audiologist from Pacific Hearing Service in Los Altos, submitted a written comment. Dear board members, the audiologist at Pacific Hearing Service would like to thank the board for addressing the issue of audiology aids and or assistance and providing the opportunity for us to express our opinions and concerns. The need for audiology assistance has become urgent over the past several years. With a severe shortage of audiology providers, patients tell us they have waited months at times to address their hearing needs. There is only so much that we can do to reduce patient wait times when our schedules are already full. As professionals, we should embrace the opportunity that staffing audiology aids or assistance provides to support our shared goal of providing timely care to those we serve. The lack of clarity and a tendency towards extreme caution by the board regarding what audiology assistance can and cannot do has had a negative impact on patient care within our practice. I think she might have meant the aids, because that's been the discussion of the board for some time, is the aids. We acknowledge the importance of protecting patients and agree wholeheartedly that audiology assistants should be properly trained and for some tasks receive direct and indirect supervision. We believe it is equally important that patients efficiently gain access to care from the professionals who can help them rather than further burdening an already short-staffed medical system. For example, currently, audiology assistants, and I think we should read this as audiology aids since they don't exist yet, assistants don't exist yet, are not allowed to use an otoscope to inspect a person's ear canal. If a patient believes they have a hearing aid dome stuck in their ear at some clinics, it could take weeks for them to get an appointment with an audiologist or ENT physician. In our clinic, we either schedule a 30-minute appointment, our shortest appointment length, with an audiologist, or when necessary, interrupt audiology appointments so that the audiologist can step out to check a patient's ear. And in many cases, the patient's ears are clear and the 30-minute appointment interrupting the current appointment was not necessary. We have had.
If I may interrupt, just
Yeah.
pause. Is it materials that's already available to the public?
No, we
Okay, go
received
ahead
this
and read it
email
then.
this morning. Sorry.
Okay, no, probably, I was just thinking, if so it's already material, in the future, we can just refer them,
Yeah.
given the length of it.
It was
Continue.
Sorry, it was an emailed one. Sorry, no, I'm sorry. Yeah, Thursday morning. 8.
I don't know if you want to just, if it's available, you can just add it to the chat. If all the board members have had an opportunity to read it.
They have not.
Okay, then go ahead.
Sorry, I know it's long. I lost where.
Interrupting, I
Okay,
interrupted you.
interrupting. Okay. Interrupting the current appointment was not necessary. We've had patients from other clinics tell us they went to urgent care or the emergency room for this non-emergency situation because they were unable to get access to their audiologist or ENT otherwise. If an audiology assistant were able to inspect the ear canal and identify the presence of a dome in the ear, that patient could move to the top of the line for what is likely to be a very short appointment with the audiologist or ENT. Alternatively, if it is obvious there is not a dome in the patient's ear, the dome can easily be replaced on the hearing aid by the assistant, thus saving the patient undue worry and or expense of an appointment with an audiologist. Anytime an assistant can serve a patient effectively, it helps that patient and every other patient who is in line after them to receive care. Furthermore, it opens up the audiologist's schedule for providing diagnostic services and using their hearing aid fitting expertise, allowing them to use the skills at the top of their license. While we feel the fitting hearing aid dispensing license is a good option for support in some clinic settings, we feel that better defining the audiology assistant or audiology aid role will further support our ability to provide quality and timely care to our patients. In addition, we ask the board to be forward-thinking as much as possible so that regulations described today do not create undue burdens on as technology changes. As an example, the decision may be made that silicone ear mold impressions should not be made by an audiology assistant due to the potential harm. However, ear scanning technology is quickly becoming more available for audiology practices and is much less invasive and hence has minimal risks with adequate training. Language should be used to keep doors open in the future as less invasive technology evolves. Sorry. As an audiology clinic specializing in diagnostic hearing assessments and hearing aid fittings, we make the following suggestions for audiology assistant or aid tasks and the level of supervision needed. We realize this is not an exhaustive list. Direct supervision, it's our opinion that there is no task that should fall into the category of direct supervision. Having to directly supervise an assistant during a task defeats the purpose of having an audiology assistant. Regarding physical silicone ear mold impressions, it is our opinion that this should not be done by audiology assistants. However, if the board decides to approve this task, it should only be done under direct supervision. This task should be reserved for audiologists and hearing aid dispensers, and there is a clear pathway to obtaining a hearing aid dispensing or audiology license for those interested. Indirect supervision, audiologists in the building are available by phone, otoscopic screening, ear clear and not clear for the purpose of referring to audiologists. This could be done with video otoscope with images saved for review by an audiologist. Hearing aid orientation, counseling the patient on how to insert or use their new hearing aids, which may include touching the outer part of the patient's ear while demonstrating the technique. Bluetooth pairing, hearing aid repairs that are possible in office, infection control and sanitizing equipment and tools. And lastly, with appropriate training, the electroacoustic evaluation of hearing. Sorry, that was long.
Great job.
That was the comment we got this morning. I meant to read that when we opened earlier. Any comments about that? Does anyone on the committee have any comments related to that? Public comment, essentially. Take it as if it were just a person here making that public comment.
Yeah, I think the biggest thing that I take from it is just the definitions, and that's what I'd said before. Just making sure that we have clear definitions of each one of them. Some of the other stuff is relevant.
Well, again, I think the discussion hopefully will lead to thinking future, rather than current state, future state. What is it that would be most effective and efficient to assist audiologists in performing their day-to-day and most efficient and effective for patient care and consumer protection, et cetera. It's interesting being at the VA and how we use our health technicians. And it's very similar, I think, to what the goal of an audiology assistant license type probably would be. And the reality is, without our technicians at the VA, the volume of patients could never be served. And our technicians are highly trained and they serve these patients extraordinarily well, and allow for access to care that wouldn't exist otherwise. So I think, while there are a lot of restrictions right now with the audiology aid, there also isn't an educational requirement, and there are a lot of restrictions even on hearing aid dispensers. So there's a testing requirement, but not a formal education requirement. So this testing process. So again, I think if we look at how speech really utilize their SLPAs to perform a lot of the tasks in the day-to-day for a speech language pathologist in order to improve access while keeping patient care at the core. I think we have a lot of opportunity there with this assistant where we're requiring education, and we can really look at a broader use, much broader than the way aids are currently being looked at. So I would just really encourage a lot of research and discussion about the opportunities for these assistants and how does it really fit into the flow for audiologists and for people who are looking for a career type in a path, that's not becoming an audiologist and going in a doctorate, but staying in the field. So I know we have a motion on the table. We need to vote on that. I don't know if the committee wishes to go into detail on any more of these specific items that were raised on the.
I just wanted to bring up one more thing that Therese was talking about grandfathering people in with certain levels of experience. The first thing that did come to mind is the VA technicians who may have 10 years of experience doing everything that this is going to enable them to do without any education. They've been doing that same exact job, performing all those tasks for 10 years. Will there be a pathway for them to gain this licensure in the private sector should they choose to leave their federal service?
Yeah, and that would be,
That sort of thing, because they probably have more experience and better expertise than anybody coming out of a 2-year program that's 20 years old. Is there going to be a pathway for those individuals who have that to come up without that degree?
yeah, that would be worthy of consideration, because the VA could potentially be a real pipeline for this audiology assistant. I think we have a lot of technicians that do this work that would love opportunities. You know, they don't want to stay in the federal government forever.
Or they want to do it on the side.
Or they want to do it on the side. So we use KOC certification, and we use a number of other qualification standards for our health technicians to achieve, you know, different levels of expertise. So they're allowed to do different types of tasks. It may be smart to look at how that equivalency could be established. Is it just a grandfathering? Is it more of an equivalency? What are the considerations there, just to help the private sector, you know, have that opportunity, that pipeline of trained individuals as well. Okay. Any other comments, Karen or Dr. Chambers, before we vote on the motion?
Is there a possibility, and please excuse my naivete, but of just taking what is currently the aid and trying to elevate its definition or its parameters or regulations some?
I think the challenge there would be the fact that the aid doesn't have any formal education requirement. And then if we just try and take the aid as it currently exists, the restrictions on it, because there is no formal education and training requirement, make it, it'd be a harder argument, I think, especially in opposition, if there were other groups that opposed some of the uses that audiology probably would like their assistants to be able to do. I think that the opposition, it'd be harder to oppose some of it, and it'd be a more clear consumer protection with having the formal education and training in there. So I think it's totally different. And I think it probably does line up still a lot better with the SLPA.
It's essentially the way the statute defines the audiology aid really limits it.
And there's space, we think that there's space for both of them, like there's roles for both of them. We don't think that most people will just transition right away anyway.
How does it work right now with SLPAs and speech aids? Because there's still both categories, right?
There are still both categories, and I think we had about like 37 applied and issued last year. 30 to 40 of them.
For aids?
Yeah, for speech language pathology aids. So every year we do still license speech language pathology aids. And they are used in clinics. I don't have anyone to comment on it, but I've seen quite a few that are, Brady's Children's Hospital uses them at their hospital. There's private clinics that use them along with SLPAs at their office. So there is still a variety of need. And again, some of this is really differentiating, you know, what are they doing? Maybe at the office, the speech language pathologist is doing the testing, diagnosis, and treatment plan. The speech language pathology assistant is providing the day-to-day therapy that the treatment plan specifies, but the aide is in there doing the scheduling, cleaning, and preparing all of the therapy materials, and doing a variety of other tasks in the office, including paperwork, that help that office run as efficiently as possible. And so that's something that we have seen in reviewing that.
And the way that it works at the VA is there are different, we call them GS levels, different scale levels for employment, and certain abilities that each level would give an individual. And so a GS4 is the most basic level of assistant that we have, and that person can make phone calls and process the mail, but they are not direct patient care under any circumstance. And then they move their way up to being telecertified, KOC certified, doing all of the other things over time.
Yeah, so I would bet They'd be really similar. It sounds like for SLPAs, there's the vast majority are SLPAs, but there's a few aids still being utilized in the tens, right? Less than 50, maybe it sounds like on a yearly basis coming in.
About 30 to 40 new
Yeah.
licensees per year.
Yeah. So I think Dr. Chambers, it would be a pretty big shift, similar to speech language pathology, where the vast majority would be coming in under the assistant category, but there would probably still be some aids as well.
Thank you for that.
So in the interest of, because I think if we answered 1, 2, 3, you know, A, B, C, D, all of the questions that were provided here, that board staff came up with, which is awesome, would probably take us another few hours to go through.
We can always go with your motion and vote and
Yep.
then start discussing these questions at the next meeting of the committee.
I
and
think, yeah.
Continue these conversations and.
Yeah, I think that would be reasonable, and also that means, you know, if we can put it on the next committee's agenda to start working our way through some of these questions, and that might assist, you know, the state association if they're trying to put something together and helping with some guidance. If it's agendized like that with the state association, if they would like, are they able to provide additional questions on top of these that they would like the committee to discuss? Is that an option, or they can provide
They can request it,
Okay. All right.
and then the board chair can always determine.
I'm just speeding things up, being more efficient when they finally do come with their actual documents that we're prepared and ready to.
My guess is that if we get through our questions, there's probably a few left along with that financial part.
Okay.
And then like application pieces, right?
Okay. All right. Okay, so let's go ahead and proceed with the vote. As a reminder, the motion was to not go through the sunrise process as a board to take up the creation of this new type of license for audiology assistant, and instead to provide technical expertise and support as necessary and as desired throughout the process as the state association decides to take this up or not on their own. And we'll go ahead and call for a vote. Karen Chang,
Yes.
Dr. Chambers,
Yes.
Dr. Sanders,
Yes.
and myself, yes. The motion carries. So we will make that report out tomorrow to the board at large, but that is the recommendation for the board to consider. In terms of moving forward before adjournment, do we need to formally ask right now that these items be added to the agenda for the next practice meeting? Okay, no, it'll just be there. Magic. Okay.
Well, I don't know if I'm magic, but
Magic.
I'm pretty good at following directions.
And before adjourning, I would also like to add my thanks to the board staff for this immense amount of work, but also to the public members who are here to help bring this discussion and move it along, and hope that we'll see all these participants and maybe even more at our future audiology practice committee meetings as we go through these discussion items. Really appreciate it. Barring any further comments from the committee, we will go ahead and adjourn at 3:11.